Hello, everyone. Bruce almost presented me. So my name is Luís. I'm from Lancaster University, and I'm part of the ARC within the MIDAS team, as you know, because we are in the MIDAS subgroup. And today I'm going to make a presentation on discrete choice experiments. Let me just say this is only an introduction because I'm not a specialist. Yeah, it's kind of weird that I'm giving a talk on discrete choice experiments without being an expert. But yes, this has a story. Let's start with the story. The story is very simple. I think it was, and Bruce can confirm it, I think it started in my job interview. I don't remember who said what, but either I said that eventually I would like to learn and do DCEs, or Bruce told me that it would be interesting if I could learn and do DCEs. I don't remember, but Bruce recorded it in his mind. And when I got hired, Bruce asked me, okay, Luís, don't you want to go learn a little bit of DCs? And I said, sure, that would be great, because I already had this interest in my mind since I like these experiments of making people choose between dilemmas. And Bruce told me that I should do a course in Aberdeen, where they have great specialists. And I said, perfect, going to Scotland, visit Scotland, learning a methodology that I already wanted to learn, perfect. What's the problem? It was the middle of the pandemic, right? And in the middle of the pandemic, the course was not happening because it is a face-to-face course. I presume there were some online courses, but when I checked for it, I didn't find any that was still happening. So what can I do? The first best is not around. The second best is not an option either. I had to go for a third best, which is dive and survive, like learning by doing. Let's start to do some DC and then learn it as you go. Try to find how you should do things. And that's what I did. If we have time, I'll show you what I did. I finished a paper with that DCE to learn. So it was my way to learn. And if we have time, I'll show you a little bit of it. So now I have the chat in here. Okay. Okay, let's just first start understanding what is the DCE. But first we need to know how economists or other researchers, well, there's a little bit of noise. If people can mute themselves, it would be good. But I think, okay, it's okay. First, you need to know how economists or other researchers do if they want to elicit preferences, which is the same thing as saying if they want to understand and analyze the preferences of people. And there are basically two methods that you can use. You have what we call stated preferences, which is, forget the jargon, it is just ask directly, ask people. So I have here one apple, one banana. Which one do you want? Do you prefer the apple? Okay, then you are basically saying you prefer an apple to a banana. Okay, it's as simple as that, ask directly. Well, there are some methodologies a little bit more complex, but basically you ask people. Then you have revealed preferences, which is you don't ask anything. Why? Because in the stated preferences, people can be strategic in their answer. Imagine that I ask them, for instance, how much are you willing to pay for this apple? They might be like, okay, you want to sell me that apple, right? So yeah, I'm going to tell you a lower price so that you charge me a lower price. Okay, they can be strategic. In revealed preferences, you don't ask anything. You check their decisions, not directly on the market of the good you are checking, because if you are going to see people buying apples, they are buying it at the market price, but they may have a bigger valuation than the market price for that apple, right? So, but you can find some surrogate markets, which are some markets which are related to the good, but are not the market of the good, and try to infer that. I have just here a stupid example of the difference between stated and revealed preferences. If you ask some people what they watch in the TV, they may say, okay, I'm very serious. I only watch the BBC News. I only watch news. That's all I watch in the TV. But then that is their stated preference. They say, I only watch the news in the TV. But then if they are always talking about Love Island and those kind of shows, it's probably they don't only watch the TVs, right? Maybe they are embarrassed to say they watch some reality shows or something like that. And then they don't tell you, but they do. Okay, so that's why you may want to use revealed preferences sometimes. So just to give you another example of revealed preferences, imagine that, for instance, you want to know the value of a tree. This is very specific, a tree. Will you go to the market? You shouldn't, because of what I told you with the example of the apple. If you go see how much people are paying for a tree, it may be that they would be willing to pay more. What you do, you can, for instance, go to, let's say, the housing market and check in the housing market, how much are people paying for a house in a place where there are no trees, and how much are they paying for a similar house in a place where there are trees. And the difference, you can kind of infer that the difference is because of the trees, right? Because of the green near the house. Okay, so that would be a way to use revealed preferences. What are the pros and cons? Well, stated preferences is very straightforward. They are very easy, so that's definitely a pro. Ask people directly. Also, they can be very misleading if it leads to strategical answering, and it happens a lot of times, mostly in environmental economics and environmental research. Now, revealed preferences would be the ideal, but they can be, maybe you need to get really creative to find a way to reveal someone's preferences, to find these surrogate markets, which are not the direct market of the good or the service. Yeah, so you need to be creative, and even if you find a way to do it, maybe you don't have data to do it, so it's not always available. Also, and this is very important because this is going to lead directly to DCEs, to the discrete choice experiments, it cannot be used on something that hasn't happened yet. So you can use stated preferences to ask people, how much would you be willing to pay for this new treatment or policy that didn't happen yet? But you cannot use revealed preferences for that, because you can only observe choices that happened in real life. If they didn't happen, they didn't happen. Okay, so let's go for the DCEs. How do I? Okay. ADCE is still a stated preference. So you ask people to make choices, but I would call it a sophisticated stated preference in the sense that you kind of not ask them so directly, you create dilemmas. You make people choose between option A and option B, where option A has some things that are better and option B has some things that are better. So it creates a dilemma. Option A is never dominant, completely dominant in regards to option B, neither the opposite. So it creates dilemmas. And through that dilemmas, if you ask them a lot of dilemmas to people, you can kind of understand what are their preferences, which are the attributes, which are the things that are making them choose option A and not option B, or vice versa. Okay. So that's it. I'm going to show you an example, but that's it. It's dilemmas. Put dilemmas, make people choose between a lot of dilemmas, and then try to infer from their choices what are their preferences. Pros and cons. Again, DCEs are very flexible, very flexible. You can basically do a DCE on anything that you want, and they are very informative because you can choose a lot of attributes and levels and get a lot of information about people preferences. They can be very complete when analyzing new policies or treatments or things like that. Also, they can predict things that didn't happen yet. I told you in the previous slide. However, another thing, they can be very close to revealed preferences if the design is good. Unless, I guess, if it is about loss. So people usually are averse to loss. I guess if you use DCEs for losses, it is not as good as revealed preferences, but if it is for gains, it can get quite close to revealed preferences. However, it is difficult. So it is not like, okay, then why don't we always do a DCE? It is difficult to create a very good design. It is difficult. And only with a good design, you can get close to revealed preferences, only. Also, it can be very expensive. Okay, you need a representative sample. Imagine you are doing something in the UK for all the population in the UK. You need a representative sample that is going to be very costly. You need a lot of procedures beforehand, like interviews, like focus groups, like pre-testing, the survey. You need to do a lot of stuff that will take time and will take money. So they can be quite expensive as well. But sorry. This is just, before I show you a DCE, this is just a guide that I will recommend you. If you want to learn DCE by yourself, start with this guide. This is a guide from the World Health Organization. I think it is for developing countries, but basically you have everything here. You have explaining what the DCE is, pros and cons. You have examples. You have even codes for Stata and SAS, if I'm not mistaken. You have real papers with real examples, so it is great. If you want to start somewhere, start with this document. It's very easy to find. But it's here. I don't know if this is going to be shared, Valerio. I guess it can be so.
Yeah, if it's okay with you, we'll share.
Yeah. I did it for this presentation. So okay. So let's go with an example. I took this example from Wong et al. 2016. I did this one. I think it's not even one with a lot of citations, but I think it is very clear, and I think it should speak to the people of health. It is about cancer consultations, cancer patients, and they have to choose between the qualities of the services. So let's just read some attributes. The first attribute is whom you consult for your cancer condition. And then you have 3 levels. You have level 0, 1, and 2. Level 0 is you consult a medical specialist in a cancer center. So I guess this one would be the best. I'm not guessing, it is the best. Then you have option 2, medical specialist in a general hospital setting. Okay, it's good, but not as good as the first one, because it is a general hospital. And then you have the third one, nurse practitioner or general practitioner with support advice from medical specialists, phone, email, or video. Well, this one is the third best. Okay, the other 2 are better. So you basically have a ranking. Now let's check the second, whether the doctor knows you. So the first is, yes, the doctor knows you, and he has or she has your records, everything, all the information. The second, the doctor doesn't know you, but there's access to your records. And the third one, neither the records, neither the doctor knows you. Okay, so clearly the best, the medium, the worst. The same with your other attributes. If you can see, number of weeks you have to wait to see the doctor, 1 week, 3 weeks, 6 weeks. Being able to take your friends or family with you, yes, but well, a medium one and a less one. And then distance, 30 minutes travel, 1 to 2 hours, 2 to 3, and then finally important stuff as well, what you have to pay, $100, $300, or $500. Now, this is the construction. You have the attributes and you have the levels. Now, what you are going to do, you are going to create dilemmas with these attributes and with those levels. Let's check one example. So you are not going to create one. You are going to create, I'm going to show you, but let's say between 9 and 16. And people are going to answer, let's say 16 times. And these things, the levels in each attribute are going to change. So the dilemmas are going to change each time the person answers. And that is what going to get us information so we can do the statistical analysis and find the preferences of people. Now, you can see in option A and B. So the first one for option A is medical specialist in a general hospital setting. In option B is medical specialist in a cancer center. So option B is better so far. Let's look at the second one. Okay, option B, I think it's a better as well. The doctor has access to your medical notes and knows you well. For example, your usual general practitioner or specialist. So option B so far is better. It's dominating completely option A. Now let's see the third one. Okay, this is weeks to wait, and it's 6 weeks. So it's definitely worse. So it's already creating a dilemma. Okay, you have these ones that are better, but you have to wait more time. So it's already creating a dilemma, right? Then the presence of family members. So in this case, family friends are unable to accompany you to the appointments. In this one, they can. So again, so you have 2 positive, 2 negative. So you definitely have a dilemma, but it's closer to your home. This one, you need to travel a little bit more. And in this case, these 2 just happen to be equal, okay? Sometimes they have to be equal to check. When they are equal, imagine that this is the strongest attribute and people always choose by the price, which definitely doesn't happen, but let's just assume for the sake of the argument. Sometimes you need to make them equal to see how the other ones interact between each other. But okay, now you do this 1,000 times, no, not 1,000, up to 16, let's say, and then you can check the preferences of people.
Hi, Luís. Sorry
Yes.
for interrupting. We got a couple of questions from Milan.
Sure.
Don't know if Milan, you wanted to unmute yourself and just ask your questions.
Okay, I see. I couldn't escape putting them there. And the first one was that could a DCE detect terrorists whom everyone might think are good citizens, but they turn out to be very different? That was one. And the other was in creating your dilemma question, are these domains equally important? And if not, are there principles used for weighting them differently?
So I missed the first question, sorry. Can you
Well, the
repeat?
first one was that could you use set up a DC for detecting, for example, terrorists? I was thinking of the Liverpool bomber. He might appear to be a very devout person and so on, but he turns out to be very different. And could your DCE sort of detect people like that?
No, I don't think so. The DC is usually, I'm going to show you, but it's usually to rank people's preferences. So you present a series of attributes and levels, and it's the idea is to rank the preferences of people between those attributes and levels, and then probably create some willingness to pay measure. So imagine this is appointment A and appointment B. This is something that the hospital may be thinking about implementing. So maybe they want to find a way to decrease the waiting time. Maybe they want to know the correct price. Maybe they want to know if people prefer a specialist in a cancer center or not. These may be true policies. And what you use the DCs for is sometimes, for instance, to know how much are people willing to pay for a medical specialist in a cancer center. Because you have the money here, you can do that. You can find this. It's not really to understand how people behave. It's more in a specific hypothetical setting, how to understand how people choose, what are their preferences. But I don't know, maybe I'm just not being creative. Maybe some people will tell you that you can use DCs to understand behavior of people. I would say no. But then again, I'm not really a specialist. I've been studying this, so I know about what I'm talking about. I would say no, but yeah, I would say no. It's not that the function, but I'm not sure. If there is anyone that is a specialist that wants to say otherwise, please, I would be glad to have them speaking. So just to give you, I'm going to continue. Just to give you another example. It doesn't have to be for a service. It can be, for instance, for job choice. It can be for the professionals of the NHS. How would they choose between two different jobs? So how do I make it live well? Okay, this is an example from Mangnem et al. 2009. And it's just people choosing between jobs. It will depend on the location, whether it is a city or a district town, the money they earn. I think this was in Malaysia or something like that. The availability of material resources, the typical work. So the provision of a house and the chances for qualifications. So this is just to tell you that there are a lot of things in health that you can apply DCs to. So how to choose, we saw how to do one more or less. Now let's just check how you should choose attributes. This is going to be very vague, and most of the points are telling the same thing as the other, just to make it not so empty. But first thing should be obvious: choose the attributes that will answer your research question. Okay, so you have a research question, really think about it. What are the attributes that are going to give the answer that you need? Now, are they realistic and relevant to the people? Yes, of course, your research question should always be relevant to the people, but check with them. Most likely you are going to do some qualitative methodology to check if people really find the attributes that you are thinking of, the levels that you are thinking, if they are going to really find them relevant and realistic. They must be realistic, because otherwise the answers cannot be realistic. So you are going to infer on questions on choices that maybe are not as realistic. Most importantly, are they clearly stated and easy to interpret? Because if they are not, if imagine, for instance, in this case, I think this is very easy, very simple, very easy to understand. I shouldn't have any problems in here. Same in here. I think this should all be fairly simple to understand, I guess. But if they are not, if people struggle to understand what you want from them, or if you make them very tired, they will start getting you answers that are not the real answers, and it's not what you want to hear. So the DCE, the discrete choice experiment, is not going to be efficient. Now, confirm that anyone will be able to answer. It's similar to this one, but just confirm there's no special skill necessary. Being quite simplistic, for instance, avoid stuff like statistics. Avoid putting percentage signs and stuff like that, because I saw a study once that said that people, normal people, are not much more literate than statistically than a monkey. And by monkey, I mean they just had some questions, they made it to the people, and then they put a computer running a random choices, and they saw that the answers from the people in terms of their statistical skills was not much better than doing randomly. So avoid things that require special skills. Also check if they are moral. Well, even if they are not, if you don't force people to answer, maybe there's not a problem in there, but yeah, make sure you are not asking immoral things for people to choose between immoral things. This is all that I did. I'm telling not to do. This is basically all that I did, is to put percentages, ask immoral stuff, but well, make sure they fit in a small box. See, make sure they fit in a small box. The simplest, the easier, the lowest cognitive burden you are going to put on the respondents, the least amount of time they are going to take, they are not going to get as tired, and their answers are going to be better, they are going to be truer, and your results are going to be better and are going to help the society the most if they are good. For the levels is almost the same thing. So I'm just repeating myself. Are they realistic? Easy to imagine? Do they provide enough variance, but not too much? So they need to provide enough variance to create dilemmas. If you have one attribute and all the levels in your attribute are barely different, then it doesn't create a dilemma. But if they are too big, they may kind of take over your discrete choice experiment, and people are answering only based on that attribute and level because it is so big, you know. So be careful about the variance. Yeah, will they provide relevant dilemmas? It's the same thing. Are they clearly stated and easy to interpret? The same thing as before. Confirm that anyone will be able to answer, the same as before. Make sure they fit in a small box. Now, I told you conceptually how to choose them. I didn't told you how many of them you should have. So this is, you probably, I don't know if there's economists here, at least Judith is here, so she's an economist, but I don't know about the others. Usually in economics, we like to put the problem as maximize or minimize something subject to something. I'm going to do that exercise in here. A DCE, in my opinion, from what I understood from my study, this is, you basically want to minimize the amount of effort from the people who are answering, from the respondents, while guaranteeing that they are answering your research question, that you will be able to fulfill your aim, right? So that would be the main rule. Try to make it as simple as possible, to make the numbers as low as possible, to make the survey as fast as possible to answer, but still while getting all the information that you really need in your survey. Unless you are rich and you have a lot of money, then do whatever you want, because then you have the money. You can go around it. But okay, in a meta-analysis by Clark, 2014, you can see that most studies use between 4 and 6 attributes. So not a lot, as you can see. Still some went a little bit over with 7 to 9. Yeah, it depends on the money you have, I guess. And then it depends also on the choice sets you are going to ask. So the amount of dilemmas you are going to ask. Most people use between 9 and 16 choice tasks. So the dilemmas, you shouldn't go much harder than 16, I would guess, because people will get tired. Yeah, it also depends on the attributes. If you have 4 attributes, you can do 16 or almost for sure. It is not going to be too difficult. But if you have 7 to 9, maybe 16 is too much. It depends. It depends on your design, but it can be too much. In terms of the average number of levels, the paper doesn't tell anything. Still, you have, it's basically what I've been saying. Typically, the levels chosen should reflect a range of situations that respondents might expect to experience. And again, qualitative data are valuable, ensuring that the levels are realistic and meaningful. Will increase the precision of your parameter estimates. So yeah, just choose something that makes sense, not too much, but not too little. Something that makes sense and that fully captures what you need in your research question. Do we have? I'm seeing that we have here 7. Do we have anything?
I think there's a quite interesting question from Andrea, sorry if I've mispronounced. Would you like to ask your question, Andrea? It says, how do we assess the information? But would you like to ask what you specifically mean, please?
Yes, thank you very much, Bruce. Yeah, Luís, can you go to the previous slides, please, for me?
Sure, which one?
So, no, that one. Sorry, number 10. I think it's number 10.
Okay.
Yes. So you mentioned here that we need to provide enough variance, easy to imagine. So how do we quantify those information? So, I mean, enough variance, what is it? Is it 0.5 to 0.6? So how do we, in some way, how can we break them down in a kind of a easy and quantitative way that we can make sure that, we are using the right stuff? Okay.
So first, you are probably going, I'll come back to this one later. Let me skip to this slide. So this is a game of balancing. And what you are going to do is, of course, you are going to use your intuition as a researcher. That's the first thing. Then you are going to use interviews. You are going to interview real people. You are going to do interviews, qualitative interviews. You are going to do focus groups. You are going to do pre-testing. And what is this? The interviews, you may ask people imagine that you, like the other one, the example from the cancer, what do they value in their experience of using the services. And people are going to tell, oh, what I value the most is that the doctor knows me and that the doctor has all the information, that he or she, they are nice with me. That's all I care about. Next to that, maybe I like also the price is also relevant. So you can ask people directly. You can do the interviews, you can do the qualitative stuff and have those answers. You can do also focus group, not only with the patients. You can also ask the professionals. You can ask other people, other stakeholders. You can do that. But yes, it probably will also depart a little bit from your intuition as a researcher. But it must have something to back it up. It must have the people in it to back it up. Then imagine that you decided like in here that these would be good measures and that they provide enough variance, that it's completely different to have a medical specialist in a cancer center and having a medical specialist in a general hospital setting. You think it is really relevant for the people, and it's different because people showed that it is different. No, I lost myself. What was I about to say? Imagine that you have these, and people agree that all the attributes and levels are very relevant and they provide variation. Now, what you can do is you can also do pre-testing. You have your survey. Let's check things like, is the survey too big? Put people answering your survey. Ask them, is the survey too big? Is it easy to understand? Is it not? Did you find that when you were answering the dilemmas, were there a dominant answer that you are like, no, I always choose this one because this one has this level and this attribute that is really dominant, and this is the one that I prefer? Or did you have difficulties? Did you found that the dilemmas were real dilemmas? You can ask people about that. Then even at the end, you can also do a pilot, which is after you have the survey done, give it to 50 people, 100 people, and do the computations. Go to your status, SAS, whatever, do the estimations, check if everything is all right, if there isn't an attribute that is kind of lost in there because people are not giving it too much importance. You can even after that adjust the levels if you think you need, okay? And the pilots are also important for other stuff, which are for the beliefs in the optimal designs, but we'll get to there later. Did I answer your question?
Sorry, Luis, are you talking to me?
Yes, did I answer, or do you think it was?
Probably I'm struggling because I tend to, to see numbers in my head. So
it can be numbers. I can show you. Well, let's see if I have time. I will not answer it to you now, but
sorry,
if I have time, I'll show you what I did, and it has numbers. So I'll explain you how I chose them. Okay, but let's see. Hopefully we will have time, I think. So okay, let me. Any other question relevant, or should I move on for now, or try to answer at the end? Because I'm seeing an 11 here. I'm scared.
Time to move on, I think.
Okay.
We'll keep answering the ones in the chat unless they're specifically for you. Okay.
So again, with this balancing that we need to do, so this is always the same thing. I'm going to repeat. So if you increase, I was talking about the numbers. If you increase the number of attributes, levels, and choice tests, imagine that you have like 10 attributes, 5 levels each, 20 choice sets. Can you do it? Yeah, you can. What is going to happen? One or two. One of them is going to happen. Either you have a simpler design, and then you increase the cognitive burden over the respondent, and the respondent are going to basically give you bad answers. It is what it is, because maybe the respondent cannot even assess the trade-offs between the dilemmas, because if you give me 10 attributes, I think I will be only able to compare 4 or 5. Like 10 attributes, I cannot choose between a dilemma with different 10 attributes between option A and option B. But even if I can, let's say, I'll be tired at some point, and the chances that I enter my random mode and I'll just start clicking randomly, it's very high. Even if I don't, probably my answers are not going to be very precise, so bad answers. Now, you can avoid those bad answers by basically money. Money solves everything. And if you have a lot of money, you can make a very complex design with partial profiles and with blocks. And by partial profiles, I mean, imagine if you have 10 attributes, I can only compare like 5, keep the other 5 constant. And as you switch between dilemmas, you switch the 5 that are kept constant. You can also do it by blocks. Instead of making one person answering 20 dilemmas, make that person answer only 10, and another person will answer the other 10 dilemmas, okay? But then it all leads to the same. You need more and more and more observations. If you need more and more and more observations, you need more and more and more money. So resources, always the economic problem. So many needs, so little resources. If you have the resources, then congratulations. You can go a little bit on the crazy side and do something more complex. If you don't, keep it simpler. I think I already talked about this one. The only thing I didn't say is that you can also do quantitative analysis pre-DCE, before the discrete choice experiment. Imagine that you have statistics that basically show that your levels and attributes should be what you are using, then perfect. And you can do the surveys by yourself. You can do the surveys to get those quantitative answers. You can also go to the literature. Sometimes the literature has a lot of information on what should be some attributes that people already value, because someone already found that they value those attributes. And sometimes even the levels, you can find stuff in the literature. So here for more recommendations on qualitative methods, so the interviews, focus groups, and so on, you probably could check some literature from Joanna Coast, which is very good. So here, still you can have the trolls, you can have people who are not really caring about that, and they give misleading answers. Again, if you have money, probably you can avoid that by paying them. But even then, you probably should be careful. So one thing that you should do is allowing people to leave, give them an opt-out or a status quo. So you can have a pure opt-out. Just for instance, I did that. Imagine you think this is immoral and you don't want to answer this, just leave. okay? Or you can have a status quo as well, which helps, which is, imagine that I'm for instance, evaluating a new policy that didn't happen yet and that people never experienced. If you give them the option of not choosing any of the option A or B, it's easier because it provides a realistic environment, it provides an anchor, so that people, they don't have to dive in on something that they don't know, and it helps to get better answers as well. So keep it simple and small. I think I repeated this already 1,000 times, but if you keep it small, people won't get tired. The likelihood that they enter random mode on your survey is smaller. Show a bar of progress, because if they know they're almost finishing, it's better be honest with them. If the survey takes 10 minutes to do, tell them beforehand it takes 10 minutes to do. And then you can also, after they answer, you can also have some tools to see if they really gave good answers or not. You can, for instance, create a placebo. You can imagine you have 10 choice tasks. You can put the last one, for instance, saying option A, always better than B. You put all the dominant levels on option A and all the dominated levels on option B. If someone shows your option B, it's because they didn't read. Okay, so you can take out that answer. Also, you can check time to completion, because if the survey takes minimum 5 minutes to answer and someone answered in 1 minute, guess what, right? You know what happened. So, okay, this is too technical, but this is creating the dilemmas. So how do you create those, let's say, 10 choice sets that are going to change and they are going to create new dilemmas? There are algorithms for this. So according to Clark et al., 2014, between 2009 and 2000, and not this number, 2012, most studies were using the optimal design. Let's not get technical. It has to do with orthogonality, and it has to do with your attributes being correlated between each other. But at the end, the optimal designs work for orthogonal or non-orthogonal, so you don't care. You can always use the optimal designs. The only issue with the optimal designs is that you kind of have to find guesses for your attributes, how important they are. You kind of have to find the results before having the results. But you can do pilot studies. The pilot studies will give you that. So you create a survey, you run the survey, you put the survey online, you get the results, and then you see more or less what the answers are saying, and then you recalibrate the optimal design and you do the survey again. So there are ways around it. Now, let me check the time. Okay. I'm already past time, but I've been answering questions. So the non-DC part of the survey is also important, because you have the choice sets, you have the dilemmas, but you also have the non-DC part where you are going to ask for social, demographic, economic characteristics of the people. Important to put all the information you need to know, but again, keeping it simple if possible. And you need to be forward-looking. You need to predict what are, for instance, a subgroup analysis that you want to do. Imagine that you think that for some reason, the preferences for what you are doing between female and male are different. So you probably want to ask about gender in the survey, okay, or income. People poorer have different preferences than richer people. Then you probably want to put income in there. Again, be careful with the length. It will always impact the level of how tired people are. So, and it affects the DCE results. Sorry, Graham? Okay, and of course, follow general rules of surveys. So I'm definitely the person that shouldn't be giving lessons on how to about survey etiquette, but with some examples. For instance, you usually don't ask people how much they earn. You usually ask by intervals, so they don't feel as I don't know, that they don't have any problems in answering. And you also always give them, for instance, a choice of not reporting. Okay, I just don't want to say how much I earn. For instance, in terms of things on for instance, gender, ethnicity, be careful, always give all the options. But again, I'm not the person to talk to you about this because I'm not a specialist, but follow the general rules of etiquette in the service to not offend anyone, to make them answer if possible, and not offend anyone. Estimating results, again, it's too technical, but if you want to know, most people are using multinomial logics, but it has to do with that opt-out or status quo question that I told you about, because it creates a third question, and multinomial models are the ones that are used when you have more than 2 outcomes, when you have 3 outcomes, 4 outcomes, and they are ordinary, so categorical, sorry. But well, too technical maybe, and I'm sorry for that. Most papers choose to show willingness to pay as the main method. And some papers with latent class analysis. This is too technical, definitely. It is about the subgroup analysis that I was talking about, but let's not dwell on it. And most papers I think are using SAS from Clark et al. So that's it. Now, just to finish, just to show you on what you can use discrete choice experiments in health in general. So it has been used in views on diagnosis, treatment, and care, like the one we saw in the beginning. Also employment preferences and of health, like we saw on the other example as well. As access to health services. So these ones are the ones that have more DCs, but then of course, if you can find anything else where you think the DC would fit well, then perfect. I'm leaving, usually I don't put it in presentations, but I'm leaving the references because if we share it, even if you want to check some of the references I used in these presentations, and I'm missing a lot, it's just the ones I decided to use in this presentation. You will have it here. Last thing, if you have some ideas and you think you could work on a DC with the ARC, so we are here. Of course, I'm a newcomer to the methodology, so imagine that it involves a lot of money and so on. We as the ARC would probably get a supervisor for me, but I would be able to help you creating a DC and implementing a DC for sure. I would also need people for the qualitative methodology because I'm not a qualitative guy, but yeah, for sure, we would be able to. If there are questions, I'm answering the questions. If not, I'm just showing you very fast what I did with my friends in Portugal to learn DCs for the ARC and to be able to now saying that I would be willing to do a DC for the ARC. So any questions or can I move on?
No, it'd be good to see the quick example. I think, Luís, I think you've got 10 minutes or so.
Yes, maybe less. Okay, so this example, I'm going to get it very short. So my idea, I'm a sadistic person. My idea was very simple. I wanted to know how many people would be willing to kill to avoid the lockdown. That's what I wanted to know. No, I'm being very sadistic. You can rephrase this in a lot other ways. You can make how much people are they willing to save to give up a lockdown. You can rephrase it, but that was my sadistic version. I wanted to know in the limit up to how many people they would be willing to kill to avoid a lockdown or let die, let's say. So we went for it with some friends. Let me just, my friends, they are all Portuguese. So Eduardo, Sara, Francisca, João, and Joana. And we did it together. So we chose as attributes COVID-19 deaths, loss of income. Again, percentages, I know I told you not to use percentages, I did. And it is not moral either, asking how many people they are willing to kill, basically. But well, I did it. Do what I say, don't do what I do, right? So loss of income, education impairment, social restrictions, so the lockdown, that was the one I wanted, but the other ones are very important. Loss of income is important. Poverty levels, so those are the attributes. Now, to answering the question that was made to me before, how do I get to these numbers? In this case, I didn't use any qualitative analysis because I think it wouldn't fit the study. So I shouldn't, it's not from like the thing that you ask people about their preferences for deaths. What I did was I checked Spain, for instance, here for deaths, and Spain had already went through to the worst phase of the pandemic. And Spain is 4 times bigger than Portugal, so I divided their maximum by 4, and it gave me something similar to this number. So I decided to use this as the maximum for Portugal, the equivalent number of daily deaths for Portugal. And then I made intervals of 100 from the highest to the other ones. Loss of income, it also has an explanation. All of them have an explanation. So the maximum is 30% because when the pandemic hit, so you had the government saying that anyone that was losing their job because of the pandemic would still receive 70% from Social Security. So the most they could lose in theory, not true, but in theory would be 30% of their income just because of the pandemic. Then you have education and impairment. There's also a logic behind it, poverty levels, and the lockdowns are the ones that we saw, okay? So this is an example. Choice A, you have 115 people, 50 people dying in one day. Option B, 50. You have decrease in household income. So this one is worse in here. It's worse in here, but it's better in here. It's worse in here, but it's better in here. So you see, it creates a dilemma, and then people have to choose between option A or option B. And by the end, we made them answer 8 times only. So this shows that I didn't understand anything about this when I did it. We did 2 blocks. We thought it would be too much. We could, no problem, do 16 times, no problem. But because it is very simple, it's a very simple design. We could do 16 times. We did 8, and we divided into blocks. It didn't make a lot of sense, but okay. But we got the results. And then when they answered these 8 times or these 16 times into blocks, right? We can kind of see how do they have their preferences in terms of that. I have here the survey, but I'm not going to show you because I think we don't have time. So here it's all negative because everything is bad for their utility, or let's call it happiness, let's call it welfare, let's call it whatever you want, satisfaction. So this is things that are bad for the people. They don't want to see this happening, all of them. So they are all negative sign. And the bigger the negative, the bigger it is to their utility, the bigger the negative to their satisfaction. So of course, deaths here get the prize, and here poverty as well, very high. They don't want to see poverty around or risk of poverty around. So, but this doesn't tell you much because it depends on how I chose the levels, right? This tells you a little bit more. This is willingness to pay. This is lives. This is literally lives. So people would be willing to kill, let's say, let die 47 people to not lose. This is not 30, it's 20 because the base scenario is 10. So it's from 10 to 30. So they would be willing to let die up to 47 people not to lose 20% of their income, more 20% of their income. And let's go to the life restrictions here, 23. So they would be willing to let die up to 23 persons daily to avoid going into a lockdown, okay? So that's the results that I have. And then you can do subgroup analysis, you can check by gender. This is very interesting. It's completely different across gender. So let's look at the restrictions. Look, like men would be willing to let die up to 53 people daily to avoid the lockdown, and women only 8. Now, I must tell you something. This survey was not representative at all. So it is not representative, and that's a big problem. Or you shouldn't do an analysis with a non-representative survey. So it can happen that for some reason women were different than men in some structural things, and it shouldn't be. We should have female more or less equal to male, and then the preference could be different because of the education that they get. But then, because we don't have a fully representative survey, we cannot say that it's about their education. But it could be an explanation because the literature says that women receive a more female education on average, and male receive a more male education on average. And female education is described as building up on values like compassion and other type of values. So it could be that as well, but because we don't have a representative survey, we don't know. Then there's also some we also check age, we check being in working from home or not, children in the household. Here, people that have both below and up to and more than 6 years of age children at home are the ones that have the biggest willingness to pay for life restrictions. This can be both a quality and quantity effect, so it doesn't tell you that much. Then you have location, education, and there are some changes. Time, I think probably if we want some questions, we should have some time for that. So if you have questions, I can also, if you don't have questions, I can also just explain a little bit more of the subgroups and so on. But if you have questions, I would be.
There's one good question, I think, from Sean about, is there any specific software for creating DCE choices, or would any online survey tool be good? Okay, so softwares, I could have a list of that, but you can, for instance, I use Stata. It's not the best though. It's not the best, but you can use. I think there's one called there's one called Nlogit, I guess, or something like that. There's one called it's something Gene. I could check. Do you want? No, it's fine. Check. I think what we could do is we're going to put the recording on the website anyway, and we can email the attendees. So if you had any recommendations, maybe. No, there are some. That one that is something Gene. I think it's one of the best. I just forgot the name. Okay, but I think it's one of the best. We can put it on the website afterwards. Yeah, that one is made really for DCEs, and it's very easy. I think you go, okay, how many choice sets do you want? How many attributes? How many levels? How many? And you just put in there and you click OK, and it gives you the design. I think that is that one that I'm forgetting the name. It's very expensive as well, so you probably need your institution to pay for it. It's very expensive. I used Stata because I had it. It's probably not the best, but then to create the design, I think one of those would be better. I'm not sure if afterwards to do the estimations, I think Stata would be better, and SAS, I guess, to run the multinomial logits or the conditional logits or whatever you need to do. I think that the ones that are better to do those types of analysis are usually better, but they are probably not the best to create your design. So Sean's just asking for your contact details for afterwards, but if you look up Luís at Lancaster University, it'll have his email, or we can put it on the when we distribute the video. We can put Luís's contact. He's typing very quickly. Yeah. Watch, it's going to be in the chat in a second. There's yes, Luís. And I forgot to put in here, right? I think I don't have in this presentation. My fault. My fault. So we're almost done. Has anyone got any final points or questions? Well, thank you. So before I forget, thank you from myself and Valerio and Angela, the kind of organizers of this, to Luís, and from the audience for putting this together. I think it's been fantastically interesting. It's a great presentation. I think the illustration at the end really shows the drama of DCE and what you can do with it. So lots of thank yous going in the chat for you, Luís, about this. So thank you very much. This is great. And maybe we could tempt you back next year to do something else. If you do a DCE in the region as well, that would be fantastic. Yeah, that would be fantastic. Just a quick word about the subgroup. We do this once a term. We do surveys of the subgroup members. By coming along, you automatically become a member on our mailing list. So thank you for that. So we will be asking around for ideas and volunteers and what you're interested in as well. Thanks, Luís. So leaving on a high note there from Luís's presentation. So yes, we will be in touch about next term and doing these once a term as well. We'd love to do them face to face, of course, but I mean, who knows what's coming? We never know what's coming around the corner these days, do we? So we'll keep going online, I would imagine, next term, but we'd love to do a face to face one at some stage as well. Thank you all very much for coming. Valerio, did you have any final words?
No, I just wanted to thank Luís again. It was really informative. I really appreciate Luís preparing this presentation for us. And thank you for everybody who attended today. Yes.
Yeah, so thank you all. And have a good holiday if you have a break at the end of the year, and otherwise we'll hopefully see you all next term. So thank you all very much. Thank you, Luís, especially.
Thank you.
Thank you.
Thank you.